Hello, my name is Stephanie Jean-Pierre, and I'm a respiratory care student here at Miami-Dade Medical Center campus. I'm here to show you a how-to video on trach care. First, we want to talk about who gets it. Well, anyone with a tracheostomy tube needs trach care because we want to make sure that no bacteria or any type of virus is around the stoma, which can cause a stoma infection or even enter into the tracheostomy stoma and into the lungs. Now, first off, before I do anything, I want to make sure I wash my hands for at least 15 seconds, which I do with the feet. After that, I'm going to go ahead and don my gloves. Now, some care practitioners choose to use one set of gloves, being the sterile gloves that come in the tracheostomy care kit. Me, I like to use two. You stay more clean and you stay more aseptic, in my opinion. Now, so we're going to go ahead and make sure we have our tracheostomy care tray that has everything I need for the care. I need to make sure I have my extra glove for necktie to replace with the one that's on the patient. So now I'm going to, of course, verify the patient, and then I'm going to go ahead and check for their vital signs, which is their heart rate, respiratory rate, blood pressure, SpO2, and temperature if need be. And I'm also going to listen to their breath sounds with my stethoscope. After that, I'm going to go ahead and set up my trach care kit. After I open it, first thing I want to do is go ahead and remove my sterile water and my hydrogen peroxide. And then I'm going to go ahead and take out this large white sheet of paper that they put so that I can dump all my sterile equipment on. Now I'm making sure I don't touch the inside of this paper because the inside is sterile. I'm staying on the outskirts. Sterile. So now I am ready to dump my trach care kit onto the sterile paper. Alright, I'm going to use these three compartments, so don't throw this away. I'm going to need the larger compartment for the peroxide and sterile water mix. I'm going to need the other two compartments for sterile water for 2 rinses. I'm going to set that aside. I'm going to go ahead, open my sterile water, pour it in all 3 compartments, then open up the peroxide and pour it in my larger compartment. After so, I am ready to don my sterile gloves. Making sure I don't touch any of the sterile equipment. I'm going to go ahead and open up my sterile gloves, making sure I stay on the outskirts. I'm going to address my non-dominant hand with my dominant hand, making sure my glove touches the outside of the sterile glove. Outside pocket. And you're going to put on your glove. Aseptically. Then I'm going to dress my sterile hands. Now, this might take some time and you might have 2 fingers in one, but that's okay. Take your time to at least get the glove on. Then you can fix it because now your hands are sterile. Go ahead and fix my fingers in here properly. Making sure I remain sterile. There you go, all done. So, I can touch the inside of this because it's sterile. I want to move this out the way. Alright. Now I can go on and and remove the inner cannula of my patient, twisting and unlocking it. A lot of gunk in there. I'm going to go ahead and put it in the hydrogen peroxide and the sterile water mixture. Now I can let it sit for just a few seconds or moments and just let the gunk in there thin up so that it's easier to clean out. Let it sit. Now time to clean. I go ahead and take my brush, grab my inner cannula, and begin to scrub the inside of the cannula, making sure I get all the way through because I want all this gunk out. Go ahead and put this brush back. Now I'm ready to rinse. I'm going to go ahead and rinse it in one of the sterile water compartments. Shake it off. And then I'm going to go ahead and rinse it again in the other compartment, making sure any residue is rinsed off. After so, I can go ahead and shake the excess sterile water off and place it on the paper. Now this gives it an opportunity to air dry because you don't want to put a wet inner cannula back in the stoma. Now I can go ahead and use one of my gauzes and clean around the stoma. I'm going to go ahead and put it in the peroxide and sterile water mix. Squeeze excess water. Remove the dirty gauze and go ahead and clean. Around the stoma. Making sure that I get all the sides because I don't want any skin breakdown. So I can use a Q-tip to get any small parts around the stoma that I wasn't able to reach with the gauze. I'll also dip that in the peroxide and sterile water mix. And then go in a little bit deeper in the crevices that I wasn't able to reach before. Being careful not to enter the Q-tip into the stoma. Now I can finally rinse off and wipe off any of the peroxide from the patient's skin. I'm going to take a fresh gauze and put it in a sterile water compartment. Of course, squirt excess water out. And then go ahead and wipe around the stoma. Right? And just to be sure, make sure everything is clean properly, you're going to go ahead and put it in the other sterile compartment of water, squeeze out excess water, and put it again, and clean it again. And also I can use this gauze to maybe dry up the excess water around the patient's stoma. Alright. And the cannula should be just about dry. I'm going to go ahead and put it back in the patient. It helps to turn it aside and then put it back in. And of course you must lock it. Now, it's time to change the Velcro ties. I'm going to go ahead, grab my Velcro strap, and get ready to change the ties. I'm going to remove the strap from this area of the flange. And to make things easier, I'm going to attach one Velcro strap to the other. Take this off. What I'll do now is just pull. Take the Velcro off the leather. Placing it on the side. Alright, now I'm going to go ahead and put the Velcro strap back in. Carefully. And then I'll do the other side. Alright. And of course, I want to replace my gauze. The gauze is very important because you don't want this tracheostomy tube and flange rubbing against the patient's neck because that can cause skin breakdown. I'm going to go ahead and replace that. Being careful not to push or tug or pull on the stone. Alright, patient's all done, all clean, everything is great. Of course, I would ask if there anything else I can do for you today. Is there any other way I can help you? And if he's okay, which he will be, hopefully, I'm going to go ahead and chart. But before I chart, of course, you want to go ahead and reassess the vital signs. You never want to forget that. Of course, I'm checking for the heart rate, respiratory rate, blood pressure, and SpO2. And I'll listen to the breath sounds, making sure he's okay. Alright, sound clear. So I'm going to go ahead and discard of everything correctly. I'm going to remove my gloves, toss them in the trash, and wash my hands for 15 seconds again. Alright, there's trach care.